We're going to start off 2025 with 5 minutes only.
That's the mantra.
So I hereby call this meeting to order of the Community Relation Committee of Board of Directors of NYC Health and Hospital for Tuesday, January 14th, 2025. Could y'all believe that? Now,
Already
yeah,
midway.
I now call a motion to adopt the minutes of November 12th, 2024. Dr. Katz?
Yes.
Dr. Mouton?
Yes.
All in favor?
Yes.
Opposed? The minutes are adopted. Please mark your calendar for the upcoming Board of Directors Annual Public Meeting for fiscal year 2025. I do encourage our CAB or our CAB members to attend and provide testimony. These meetings will begin at 6 p.m. on the following dates and location. For Queens, is Queens in the house?
Queens is in the house. I
Okay.
see them.
Okay, February 11th, 2025 at Elmhurst Hospital. For Manhattan, is Manhattan in the house?
Right
Yes, we are.
March 18th, 2025 at Gouverneur. For Brooklyn, is Brooklyn in the house?
All the time.
Brooklyn.
April 29th, 2025 at South Brooklyn Health. For the Boogie Down Bronx, is Bronx in the house? Tuesday, May 20th, 2025 at Jacoby Hospital. Now let's see if Staten Island is in the house. Kind of quiet. Anyway, pass the word. Tuesday, June 17th, 2025 at Seaview. Speakers are asked to register in advance online by calling the one and only Ms. Calethea Hercules, Secretary to the Correspondent Corporation at 212-788-3359. Did you get that? 212-788-3359. Now, I proudly turn the meeting over to the famous Dr. Katz for his remarks.
Thank you, Jackie. Lots going on. Welcome, everybody. Happy New Year. Thank you for all you do to make Health and Hospitals the amazing organization it is. We reached agreement tentatively with Doctors Council at 1 a.m. on Sunday morning.
Yes.
We're very happy about that. We love our doctors, and we're glad that we were able to come to an agreement that everybody is happy with. Kings County Hospital on the right brought in the first babies of January 1, and it was a double victory. It's a double. And you beat out, South Brooklyn Health that had been hogging, we feared perhaps unfairly,
I didn't say that.
yes. But anyway, we're another hospital in Brooklyn won this year, so we're very pleased about that it was our own. Bellevue Ambulatory Care received the designation as age-friendly, and this is something that I think all of us want to work on throughout health and hospitals and throughout our lives. Remembering that as people age, they need a different system. And I got my Medicare card on over the weekend, so the issue is in my mind. We have two new chief medical officers, Dr. Melissa Martin and Lucan Rodriguez, chief medical officers at Kohler and McKinney, respectively. We celebrated 36 nurses in 6 hospitals at annual Nurse Excellence Awards. Elmhurst now has a long stay unit, which we have found a great way to help people who need a little bit more time to really fully recover after a psychiatric hospitalization. Our Pride Health Center staff were named 2024 winners of Interprofessional Humanism and a Healthcare Award. We unveiled a new mural that was at Jacoby, where there was a very nice article about a member of the Kohler family who got a very special surgery at Elmhurst and was therefore able to regain use of their hand, which was really amazing. And then several of us were at the flood wall opening at Metropolitan, which is very, very exciting, which will protect our important hospital from the risk of flooding due to climate change. So with that, Madam Chair, I have look forward to hearing from our great cabs and facilities.
Thank you, Dr. Katz, and they are great. We will now hear from the 4 facilities presenting their verbal annual report. Each presentation is allotted 5 minutes, and we are grateful for the work that went into preparing them. Thank you in advance to all our speakers for their time and commitment to the system. And again, Happy New Year's to you. I will now present Miss LaShawn Henry, and I said to her earlier, I said, I miss you, LaShawn. So I give you Miss LaShawn Henry from Carter Cab.
Thank you, Madam Chair. Happy New Year to everyone.
New Year.
I'm going to do the Carter CRC report, equipment and infrastructure. This year, Carter Hospital has made significant improvements to our equipment and infrastructure at the hospital. The nursing den dialysis is fully completed and is licensed by New York State Department of Health. We now offer inpatient bedside dialysis at the LTAC under the leadership of a board-certified nephrologist. Philips installed telemetry equipment is now in place to support and enhance the cardiac rehabilitation program and is actively serving residents. Residents were safely relocated to the LTAC on October 25th, 2024 to ensure continuity in staffing, services, and activities and a seamless experience for residents during the ventilator expansion project. New feeding and IV pumps have been added. The employee wellness room underwent a redesign and has received over 11,500 visits during the 2023 to 2024 years. Our employees now have a 24-hour access to a space focused on relaxation and rejuvenation, promoting employee well-being. Patient safety and satisfaction. Patient safety and satisfaction remains a top priority for leadership, the CAB, and the staff. Carter is honored to be recognized by the U.S. News and World Report as one of the best nursing homes for 2025, specifically for short-term rehabilitation, and also received acknowledgement for our long-term care. Carter was ranked number 5 on Newsweek magazine's Best Nursing Homes list out of over 600 facilities in New York State. The recognition validates Carter's ongoing commitment to person-centered care and the I Care with Kindness model. Frequent complaints by patients and residents. Overall complaints remain low, with the most common issue being attitude, courtesy, and delay of care. To address attitude and courtesy, we have an upcoming I Care with Kindness training in Q1. Have added of a wellness program associate and continue ongoing wellness rounds and a group debriefs to support staff. To address the delay of care, we have continued to modify care plans based on patient-resident preferences. Carter's community impact. Carter continues to provide uncompensated care to those ineligible for public benefits. We are aligning with the broader health and hospital's mission. Since its start in January 22, 73 candidates have participated in the nursing aid certification program, with 38 currently working on the units. The Community Advisory Board, the CAB, grew by 4 members in 2024. The CAB participated in Senior Day sponsored by New York State Senator Cordell Clear. Some other community-related events included voter registration, toy drives, and a partnership with the Uptown Grand Central farm stand. Diabetes and high blood pressure continues to maintain a high prevalence in the East Harlem community. We are committed to continuous outreach through health screenings to address these issues. We are excited about our strategic plans for 2025 and the positive impact it will have on the East Harlem community. We look forward to furthering the health and hospital's mission and ensure Carter remains a premier post-acute care facility. Acknowledgements. We'd like to express our gratitude to Carter's clinical and operational leadership for their dedication to healthcare and our strategic partners, which include the Honorable Adriano Espaillat, who is our congressman, the Manhattan Borough President, the Honorable Mark Levine, New York State Senator Cordell Clear, New York State Assembly Member Jordan Wright, New York State Assembly Member Edward Gibbs, Council Member Diana Ayala, Henry J. Carter Wheelchair Charities, Mr. Hank Carter, Henry J. Auxiliary, and the Community Board 11. Also, Uptown Grand Central, Ms. Carrie King, the NYPD, FDNY, Jeanette Rosario, Associate Executive Director of HJC, and Nyron McLeish, our CAB liaison. Thank you.
And thank you. I was getting ready to say, now, do I have to bring the hooks? But excellent, excellent. Good job. Just keep up the good work. Dr. Katz?
It's a great report, thank you.
Thank you, Dr. Katz.
Dr. Morthon?
Excellent report, thank you.
Thank you.
Now we have East New York. Ms. Fur Gibbs.
Thank you. Good afternoon, everyone. Happy New Year.
Happy New Year.
Happy New Year.
This year, Gotham Health East New York has made significant improvements to its equipment and infrastructure at this facility. East New York has opened a staff wellness center, which is designed as a tranquil space where staff can relax and take mental breaks. This space features soothing natural sounds, offering a peaceful environment for rejuvenation during breaks and downtimes. A new Hologic 3D mammography unit has replaced the old obsolete model. The Behavioral Health Clinic is undergoing a cosmetic upgrade. This includes new floors, lighting, and furniture. The most frequent complaints are long wait times, unanswered phones, and communication. East New York is addressing these complaints through active listening and demonstrating empathy, setting clear expectations with cultural sensitivity, encouraging patients to use MyChart instead of calling, engaging in open dialogue, and asking clarifying questions, understanding nonverbal cues and being transparent with patients, collecting consistent feedback about wait times and addressing these concerns. East New York continues to use the eye care culture to enhance its patients' experiences as it aims for each of its patients to have a positive experience. East New York engages in weekly rounding to ensure clinic safety, address patient satisfaction issues in real time, solve problems promptly, thus improving the overall experience. East New York seeks to understand and treat the patients it serves. Programs for diabetes and hypertension include Treat to Target program and a diabetes wellness program. East New York has received awards from AMA and AHA for its blood pressure and diabetes management programs. East New York also offers holistic, culturally sensitive treatment and education for obesity management. East New York continues to face significant behavioral health staffing challenges. Although most positions have been posted, recruitment remains difficult across Gotham Health. Currently, there are no candidates scheduled for interviews. East New York is actively engaged in health education and raising awareness in the community. Community Affairs has successfully conducted numerous workshops and community seminars, including ID NYC awareness and registration events, national HIV testing awareness campaigns, a successful back to school event with 30 plus community partners, and the Juneteenth parade and reception. East New York thanks its clinical and operational leadership for their tireless commitment to serving the healthcare needs of the neighborhoods in East Brooklyn, as well as its dedicated staff. East New York also thanks its strategic partners who help to amplify the impact of its work. Brooklyn Borough President Honorable Antonio Reynoso, New York State Senator Honorable Roxanne Prasad, Assembly Member Honorable Eric Delan, and New York City Council members Honorable Chris Banks, Honorable Sandy Nurse, and Honorable Darlene Neely.
Thank you so very much. Keep up the good work.
Thank you.
So now we have the famous Kings County, Miss Lorraine Chin, Cab Chair. Okay.
Good evening.
I'm sorry. I did not ask my doctor and doctor, do they have any questions?
This doctor, no questions.
Excellent report, thank you.
Very
Okay.
nice report.
Thank you. I got carried away. It was so good. Miss Lorraine?
Okay, go ahead. Okay, good evening, everybody. Happy New Year. I'm calling from Kings County Hospital. At Kings County, we take pride in providing high-quality care with modern facilities, the latest technology, and a skilled board-certified staff. We are focused on continuous improvement to enhance patient experience across our services. We have modernized 4 elevators in the E building with the cone elevators. We also have a transition area on C ground floor, which will serve as the overflow area for the emergency department. We have a new project in the T building for an ADA compliant bathroom to ensure accessibility. Building management system upgrades in both the S and R buildings to improve campus operations. Campus-wide hot water system upgrades ongoing. We have spent our patient satisfaction. We have spent our first year as a Silver Certified Center of Excellence in Person-Centered Care, integrating frameworks like shared decision-making and compassionate communication. The key initiatives include executive leadership rounding and the support of our Patient Family Advisory Council to rethink how we deliver care. We expanded our Press Ganey survey programs to include behavioral health and pediatrics and are working directly with service line leaders and frontline staff to improve experiences throughout the campus. We also participated in a campaign to capture more community sentiment about our hospital based on star ratings on social media. In our emergency department, we have instituted 24-hour advocacy through a dedicated team of bilingual patient representatives to help respond to our patients' needs in real time. The patient compliments also continue to increase, with 741 compliments collected last year. Frequent complaints. Complaints rose by 83% to 830 once we began the 24-hour ED patient representative assignment. And that's because there was more data being collected since those representatives were instituted. And so so we're getting more of the complaints immediately. But in the grievances dropped by 37% because the issues were resolved in real time. top complaint categories include staff communication, style, and wait time, mainly in the emergency department, which is the 19th busiest ED in the nation, particularly for patients waiting for beds and patients waiting for tests or test results. We are focusing on continuous improvement through eye care with kindness, training, and communicating with empathy programs. Also, in our ED, leadership meets with the care experience and patient guest relations staff multiple times a week to review the issues and find resolutions. Issues impacting the community, a lack of affordable housing and inflation have caused problems for seniors in the community who are on fixed income and cannot keep up with the rising costs. Community forum members believe that the lasting impact of the pandemic, bail reform, and people with untreated mental illness likely all play a role in the rise in violence. There needs to be more awareness of mental health issues within schools, as a precaution is better than fear. Limited availability of affordable, quality produce. Happenings impacting the community. We are actively involved in addressing these community challenges through programs like the Commodity Supplemental Food Program and mental health wellness fairs. We also provide a Consumers About Friends Family Education Cafe support group for individuals in the recovery and their families, fostering community and resource sharing. This is not limited to to only patients. We are inviting other members of the community. At least it would help with the awareness. Wait times in the emergency room continues to be a challenge. The introduction of pivot process and the hospitality cart in the waiting areas have been used to address this. There's also high demand for services in both our dental and ophthalmology practices, and more space is required to accommodate this need. Acknowledgements for their ongoing support for expanding and enhancing access to person-centered care, treatment, and services provided to the patients and staff at Kings County. Our special thanks and gratitude are extended to the Office of Communication and Public Affairs, Kings County senior leadership, Bar President Antonio Reynoso, and Council Member Rita Joseph. That completes my report from Kings County.
Thank you so much. Dr. Katz?
Very good report. Thank you so much.
Dr. Mawthorne?
I just want to comment on the 24-hour advocacy that you have in the ED. I think that's an excellent way of approaching this, and hopefully the face-to-face interaction with whomever's doing this with the patients will be very encouraging, and them expecting the quality of care that I know Kings County can provide.
Thank you.
So I have a question.
Yes.
It's a great question. So you mentioned there's a high demand for dental and ophthalmology service. Do you refer the patient to other facilities if possible?
Want me to answer that or you answer it? I can take it off.
And we so glad we got the CEO here. He gonna take it.
So we specialize in dental services, and it's hard for us to refer out to our sister facilities because we have a residency program and we do orthodontics, periodontics, and so forth. So they refer to us for care. So we are the last stopgap, as it were.
What about for eye?
Ophthalmology, we also are the last stopgap. We have specialized ophthalmological services at the hospital as well.
Very good. Doctor, you have any more questions? Okay, thank you. So now we have Queens, Miss McFadden, on behalf of Miss Robin Hodge, Cab Chair.
Okay, Happy New Year, everyone, and
To
good evening. My name is Doretha McFadden. As the Vice Chair of the Community Advisory Board at NYC Health Hospital Queens, I am excited to share our progress and initiatives that highlight our ongoing commitment to enhancing healthcare in our vibrant Southeast Queens community. The infrastructure and equipment improvement. This year, we've made significant investments into critical infrastructure and equipment upgrades. Notable projects include renovations to the interventional radiology, MRI, and Linac suites, as well as the launch of a home perineal dialysis center. These upgrades reflect our dedication to providing high-quality, accessible care to our patients. Patient satisfaction and safety initiatives. In 2024, we saw remarkable improvements in patient satisfaction across various service lines. Our patient medicine department recorded a 9.1% increase in the hospital rating, and our emergency department overall score improved by 6%. These enhancements are a testament to our staff commitment to a person-centered care supported by the expanded Helping Healers Heal program focusing on the 8 dimensions of well-being. Frequent complaints and grievances. Additionally, we've implemented proactive measures to address patient complaints. With a focus on person-centered initiative, we have reinforced communication and service recovery strategies, contributing to a 2% decrease in grievances received this year. Happenings impacting the community. Our hospital remains vigilant in addressing health disparities within our community. We launch efforts to promote early detection through events like the free prostate cancer screening and the mammography screening, highlighting the importance of accessibility in healthcare for underserved populations. Celebrations such as Hispanic Heritage Month and Diwali reflect our cultural diversity and dedication to inclusivity, allowing employees to learn and share about various heritages. Acknowledgement. I want to extend my heartfelt appreciation to our clinical and operational leadership led by our CEO, Mr. Neil Moore, our CMO, Dr. Dave Holson, and our CNO, Dr. Abigail Babala, and our COO, Ms. Marzi Strudowski, who work tirelessly to meet the healthcare needs of our community. We are also grateful for the support of local government partners, including Congress members Grace Ming and Gregory Meeks, Senator Leroy Comrie, Assembly members Alicia Heineman, David Weprin, and Nili Rosick, City Council members Jim Genera, City Council Speaker Adrian Adams, and Borough President Donovan Richards, who all play a crucial role in securing the necessary resources for our hospital. As we look forward to our 90th anniversary celebration in 2025, let us continue to work together to ensure that NYC Health Hospital Queens remains a leader in providing compassionate, equitable care to our wonderful community. Thank you for your time and look forward for discussions on how we can work together to uplift our community, neighborhood, health, and well-being. Thank you.
Thank you, wonderful. Dr. Katz?
Great report, thank you.
Dr. Monthon?
Thank you for your wonderful report. Thank you.
And I see somebody starting to clap. Let's clap for everybody. So, just let me say before we end, I am just so proud to be here, sitting at the helm as community relations, because the cabs are so important to the community. How do I know? Because I'm all boots on the ground. And when they feel that they could go to any of these clinics and get the best service, and that's the word on the street, that's real, I have to say, I am so proud. Is it perfect? No. But is it getting there? Yes. Because as we sit here, right, Dr. Katz, Debbie, Afinte, and we hear these reports, and your team, the team, it really makes us feel good because we care, and this is what we look for. Do some sound better than others? Yeah, because you have a little bit more going on and bigger space or whatever. But all of them are good, and everybody's doing different things. that makes me proud. And it takes, and look at the COs that came out. Sometimes they don't have to come, but they come to hear what they people gonna say, so y'all, just, you know. So, but I wanna thank the COs for coming out, because that's important, because that means that your facilities is important to you and you care. So with that, it takes a team, and for 2025, I just want to say, not only Dr. Katz, because we know he's at the helm, he gets it done. You got Debbie here, Deborah Brown, for those that don't know. This is how it all happens with these cabs. You got a Fente, I never say his name right, did I say it right? Kim Fay. Kim Fay. This is a great team. And what's our other young lady that sits? Emmanuel. Yes. Listen, it takes a team to do this. I just want y'all to know, just for 2025, I might not let you know another time, but starting it off and kicking it off right, these are the people who really make it happen. And then when you talk about leadership and people that work hard, and they're in the background, but they're forceful. You have Calethea Hercules. Let's just give her a hand. Because she really put up with all of us, especially me, when she called. I said, oh, Lord. And you got Jenny. And you have Wilton. I mean, so it's a team in here. Dr. Katz have a wonderful team. And you have you, the cabs, Dr. Marthon. So it takes a lot to work, and God bless you, and Happy New Year's again. And let's keep it going. Let's keep our patients and our community satisfied. And I'll look forward to you in 2 months. Is it 3 months or 2 months? Anyway, keep the good work going.
Thank you.
So I guess that's it, huh? Any old business? Any new business? I'm not gonna say any new business from the members. Anyway, just make sure that y'all go to your committees, and let me just say again about the cabs making the annual public meeting. All this is important. Again, Queens, Tuesday, we just have a few minutes, so let me say this again, so you won't say you didn't get it, so pass the word. For Queens, Tuesday, February 11th, 2025 at Elmhurst. For Manhattan, Tuesday, March 18th, 2025 at Gouverneur. For Brooklyn, Tuesday, April 29th, 2025 at South Brooklyn Health. For the Bronx, Tuesday, May 20th, 2025 at Jacoby Hospital. For Staten Island, and Staten Island is cool. They in the house. Tuesday, June 17th, 2025 at Seaview. Thank you, and be safe.
This meeting is no longer being recorded.